The process of ejaculation involves release of semen from the male reproductive system. So we're going to have an overview of ejaculation, and mainly we're going to talk about types of ejaculation. But what is ejaculation? The process of ejaculation is the release of semen from the reproductive system, and it is I'm going to give an overview over the same. So ejaculation occurs in processes in male. The first phase, we have what we call the arousal phase, where the process usually begins with the sexual arousal, which can result from physical or psychological. By physical, I mean through touch. Also, men get stimulated with the visual when they visualize uh, and put their mind there. So we have the arousal phase of it. The immediate thing which happens is what you call erection. Blood flows into the penile area, so causing it to become erect. And this erection is maintained by the engagement of blood in the spongy tissues of the penis. Guys, welcome to our video today. The channel is Future Talks. Kindly, if you have not subscribed, I want to encourage you to subscribe and give a nice comment down below, guys. And if you have not shared it, kindly share with your friends, and also want to encourage you to get in the channel. This is where we do the vlogs, which are really are really interesting. Kindly, if you have not watched the previous videos, I want to encourage you to watch. And also, like you said, we want to take the channel is to 10,000 subscribers before the end of the year. And for any support, we have the details in our description where how you can get us and also get to support us. Especially, we need our improved studio where we can do these videos and also get to teach you what you want best. Here, I don't use a lot of complicated medical terms. I teach in very simple words in which you can always understand in a common way. So matter is complicated, but they well explained in a very simple language in which we can understand. So from arousal, we have direction, and when we have had direction, we have what you call stimulation. This is where now the stimulation phase, where the sexual stimulation continues through the physical contact or sensory stimuli. So, and what occurs, we go to the ejaculatory reflux or reflex. When a man reaches a certain level of sexual arousal, the ejaculatory reflex is triggered. This reflex involves a series of contraction in the muscles of the pelvic region, whereby now you get, but in particularly the bulbocavernous muscle, what you call bulbocavernous muscle, and the ischiovernous muscle get involved, so that to get to the ejaculatory reflex. The next phase after the ejaculatory reflex is stimulated, we get to emission level or the release level. During the emission phase, seminal fluid is produced in the seminal vesicle through through the prostate gland also. This fluid contains sperms as well as various substances that now reach the sperm and also to protect the sperm. So the prostate, in my previous video, I talked about the prostate. Kindly, if you have not watched it, you can also check on it, where what we will see what is the role of the prostate, and when it has a problem, what's supposed to be done. Kindly watch the previous video on what you called uh, BPH. So another phase where we go to after the emission, we go to expulsion phase. Expulsion by now expulsion phase. So as the ejaculatory reflex continues, the muscle at the base of the penis contract, forcing the semen from the seminal vesicles and the prostate into the urethra. So finally, we have a ejaculation phase where now, at this point, the semen is expelled from the urethra through the tip of the penis in a series of rhythmic contractions, and ejaculation is often accompanied by the sensation of intense pleasure and orgasm. So another after the ejaculation, that we have what you call refractory phase. Now, where after ejaculation, Most men experience this refractory period during which they are temporarily unable to achieve another erection or orgasm. This is a period of rest, and the length of period of this kind of thing of a refractory period varies from individual to individual. So, guys, it is important to know that it is typical the process. Typically, the process of ejaculation, there can be variations and the factors which affect this, and we have factors such as age, health, and individual differences, which can affect how one gets to these ejaculation levels or phases. So, additional factors like anxiety, stress, and certain medical conditions such as diabetes, hypertension, influence the timing and the quality of ejaculation. But if you have concerns or questions, it's always good to share with the healthcare provider or your urologist for guidance. So I talked about we're going to talk about the phases, the ejaculation part of it, and the types of ejaculation. So, like I've said, ejaculation refers to the semen, the release of semen from the male reproductive system, and we have different types of ejaculation that is scientifically studied, and also they have classified it in four categories. Number one, we have what we call antegrade antegrade ejaculation, and this is the most common type of ejaculation in which where semen is expelled from the urethra at the tip of the penis during the sexual climax. It's called antegrade ejaculation. Number two, we have what you call retrograde ejaculation. In the retrograde ejaculation, we have semen is forced backward into the bladder rather than coming out through the urethra. This can be a result of certain medical conditions or medications, and this which affect the sphincter of the bladder. So we get that instead of the ejaculation, the sperms coming out, they retrograde, they go back to the backward into the bladder. We also have what we call type of ejaculation, which is called nocturnal ejaculation. Sometimes it's referred as wet dreams or nocturnal emissions. This type of ejaculation occurs during one sleep, typically during dreams which have some sexual content. So that is what we call nocturnal orgasm or ejaculation. Another type, last but not least, is about dry orgasm. In dry orgasm, there is a sexual climax without the release of semen. This can happen in situations where there is a blockage or damage of ejaculatory ducts. If a person has had a surgical procedure like vasectomy. So dry orgasm is whereby you get the climax, but no release of semen, especially the people who have gone through surgical procedures such as vasectomy. So for vasectomy, also works as a form of family planning for male. So they have you get that they get to work on the what you call dry orgasm as a type of ejaculation. So, guys, it is important to know that antegrade ejaculation is typical and healthy type of ejaculation during the sexual activity. Retrograde ejaculation and dry orgasm can be related to medical conditions or treatment and should be discussed with the healthcare providers if it occurs without cause. Nocturnal ejaculation is a normal and occurs in many men, especially during adolescence also and the adulthood. So, guys, those are the four types of ejaculation which we must take note of as I've talked about. I also need to share that if you have any concerns or issues related to ejaculatory process or sexual health, there are several steps that you can take if you have any concern. Number one is to consult your urologist or your healthcare professional. If you are experiencing persistent problems or have questions about your ejaculatory process, it is good idea that to speak to a healthcare provider or your urologist so they can provide through evaluation and also advise and recommend appropriate treatment and also interventions. Number two, maintain overall health. Good sexual health is closely linked to your overall health. Each balanced diet, get regular exercise, manage stress, and get enough sleep to support your sexual well-being. Another thing is about lifestyle changes. If issues are related to lifestyle factors such as stress, substance abuse, medical side effects, consider appropriate changes to address these factors individually as it goes by. Another thing which your doctor or your healthcare provider can teach you, especially, is about the Kegel exercise. We've talked in many videos about this Kegel exercise, and this is one of the factors which is also very important. Kegel exercise can help improve ejaculatory control and the sexual function by strengthening the pelvic floor muscles so that they can be beneficial for some individuals. This is where you get to exercise your pelvic muscles in a special way as taught by the healthcare provider so that you get uh, uh, to strengthen your muscles and also avoid such kind of problems. Also, on the part of medication, in some cases, medication prescribes address the specific sexual health concerns such as premature ejaculation and erectile dysfunction. So there are medications which you can be given if you have ejaculatory problems where now they get to solve your premature ejaculation and also erectile dysfunction. Also, a very important factor is about counseling and also therapy. If psychological factors are contributing to your concerns, therapy or on counseling, either individual or a partner, can be helpful in addressing these issues. So some of these ejaculatory problems are psychological. So there's a way the psychological, clinical psychology can help with this to get as a form of therapy to get one into normal, so into normalcy over the same. Also, communication, open and honest communication with your partner is very important. Discussing your concerns and working together can improve your sexual experience. So share your fears and also the affects which affects your, especially your sexual performance and sexual health with your partner to get a solution over the same. So guys, remember that sexual health is a personal and sometimes sensitive topic. uh, Think sex are not very much discussed, especially here in Africa. Is a taboo, what we call a taboo, especially at community level. You can't discuss matters sexual with your father, your kids, and also with your family because it is very sensitive. So, and it's personal most of the time. So, it is essential to seek professional guidance and support when needed. A healthcare provider can help diagnose an underlying issue and guide you most appropriate treatment or strategies to improve your ejaculatory process and the overall health. Guys, welcome to our channel. Channel is Future Talks. Kindly, if you have not subscribed, I want to encourage you to subscribe and I want to welcome you to our next videos. Peace, guys. Welcome.